Opioid deaths rose dramatically across Ontario during the pandemic, and according to the Office of the Chief Coroner, that hit northern communities hardest. Charnel Anderson covers the Northwest for Ontario Hubs. She joins us now from Thunder Bay. Hello, Charnel.
Hi, Dan.
All right, so earlier this week was International Overdose Awareness Day, and you wrote about the opioid challenges in Northern Ontario specifically. How would you summarize the situation there?
So it's not good. As you said, the coroner's office recently released data on opioid deaths in the province through the second year of the pandemic. And the top 6 health units, so that's health units with the highest rates of opioid-related deaths during this period, were in northern communities. And topping that list is Thunder Bay, which had the highest rate of opioid deaths overall at 82.1 deaths per 100,000 people. And so that's more than 4 times the provincial rate for the same period. And, looking at this data overall, deaths from opioids rose dramatically during the pandemic. So the year before COVID, roughly 4 people per day died from opioids, but that doubled to 8 people per day during the second year of the pandemic. But the good news, if you want to call it that, is during the first quarter this year, opioid-related deaths dropped 10% compared to the same period last year. However, this data it contains both confirmed and probable opioid deaths. So these figures may change a little bit, but I think we're all hoping to continue to see this decline.
You mentioned the COVID-19 pandemic. What was it specifically about the pandemic that made the situation worse?
Well, so of course, a feature of the pandemic was isolation, and that led to changing habits among drug users who are encouraged not to use alone, in case they overdose. But because of COVID, services like safe injection sites weren't open as they normally would be, possibly leading people to use alone, which is really one of the tenets of harm reduction. Don't use alone because it can be really dangerous. And, there were other issues like border closures that possibly impacted the drug supply. And then there's concerns that the drugs themselves may have been more toxic. So there's really a number of things, pandemic-related effects that may have caused the rise in opioid deaths.
All right, so you spoke to the not-for-profit Elevate UWO. NWO obviously stands for Northwestern Ontario. How is their organization helping drug users and the situation?
So Elevate is a community-based nonprofit, as you said, here in Thunder Bay, and they provide services for people living with HIV and AIDS, and they also do harm reduction. So they have a peer program where people with lived experience go out and provide harm reduction. So they'll help people connect with services if that's something that they want, and just connection in general, making sure people are okay and that they have what they need. And another initiative that Holly, she's the executive director at Elevate, an initiative that she's really proud of is a housing project that Elevate runs, which can house up to 40 people at a time. And, its focus is harm reduction as well. So they understand that people are going to use there and that will never be used as a reason to kick someone out. So, of course, it's a much safer environment than using alone on the streets.
Now, we talk obviously about the work that they do, but I want to talk about the frontline workers. You spoke to Holly about sort of the toll that the pandemic and sort of the crisis has had on her workers. What did she have to say?
Yeah, so Holly told me that over the last 3 years, they lost 30 clients, people that they work with, some of whom died from an overdose, some of whom they don't necessarily know the cause of death. And, she told me that her and her team develop really strong relationships with the people that they work with. These are people they've known sometimes for years. They get to know their families and their friends and their histories. And then all of a sudden they overdose and they're gone, so there's an enormous sense of loss that's left behind when people die from opioids. And, after something like that happens, Holly will sit with her team and talk about it. And, there were people that had moved into Elevate's housing program that passed away, sadly. And, as awful as it is, there was some solace in the fact that they died while they were housed. As Holly said, they didn't die in a ditch somewhere. And so she said that's, kind of what helps drive them to do this work. As hard as it is and as much loss as they endure, they do it because they want to help people.
So, Charnel, let's talk about solutions. What are the recommendations coming out of Elevate that could really start to make a difference?
So Holly's top 3 solutions are safe supply, better resources for safe injection sites, and the main point really that she emphasized is housing. This is an issue for not only people in Thunder Bay, but the region, Kenora, Dryden, etc. And, it ties into issues like poverty. And that's something that, Holly's really looking for or towards as we enter municipal election season here in the fall, because there are solutions for these problems. And, we just need the support and the people who are willing to make that happen.
An important story. Thank you so much, Charnel, for joining us on the program.
Thanks.
The agenda in the summer with Namkiwanuka is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.